Welcome to the Choose Health Action Team's introductory webinar. Choose Health Action Teams, or CHAT, is a collaborative initiative of Cornell Cooperative Extension's Foray Youth Development Program and Cornell's Division of Nutritional Sciences. It integrates youth engagement and efforts to encourage healthy lifestyles by having teams teach healthy eating and active living to younger youth. I am Wendy Wolf, Research Associate in the Division of Nutritional Sciences at Cornell, and I and my colleague Sally Crozier, a youth development consultant and former county 4-H educator who helped develop this initiative, will lead you through this webinar, Modeling the Nutrition 4-H Collaboration. First, let me just give you an overview of what we'll be covering today. We'll talk about what the Choose Health Action Teams initiative is, and as part of that, we'll tell you about the Choose Health curriculum that the teams teach to younger children. We'll talk about experiential learning via the 4 A's, and you'll hear what that is in just a moment. But the bulk of today will be talking about the CHAT Facilitator Guide and walking you through that, including some background on the best ways to use teams as teachers, and also how to recruit teams to be CHAT, talk about training using some modules that we've developed, evaluation, and then we'll hear from 3 educators from counties in New York State about their experiences in using the Choose Health Action Team initiative. This is the cover page of the CHAT Facilitator Guide, which is available on our website. It gives you all the details you need to conduct CHAT. And we'll walk you through the guide a little later in this webinar. So in CHAT, or Choose Health Action Teams, educators or other CHAT leaders recruit, train, and mentor local teams to then teach or co-teach our newly developed nutrition curriculum, Choose Health, Food, Fun, and Fitness, which we often call CHIF. And this is the settings that it's taught in include after-school programs, summer camp, schools, and other settings. By co-leading delivery of the curriculum, the teams gain leadership and facilitation skills, as well as improving their own eating and activity behaviors. Shown here is the first page of the CHAT Facilitator Guide. Now, Choose Health, Food, Fun, and Fitness is the interactive curriculum that the teams help teach. It's aimed at 8 to 12-year-olds and includes 6 lessons that use experiential learning to teach healthy eating and active play, targeting the behaviors shown here, which research suggests are the most important for preventing childhood obesity and chronic disease. These behavior goals are: drink water and low-fat milk instead of sweetened drinks, eat more vegetables and fruits, eat more nutrient-rich and high-fiber foods and fewer high-fat and high-sugar foods. So that includes whole grains. Eat only as much as needed to satisfy hunger. So get in touch with your hunger and satiety cues. Play actively 60 minutes a day, limit screen time, and promote healthy behaviors. Now, Sally is going to tell us a bit about the Foray experiential learning.
Thank you, Wendy. Both CHIF and CHAT use, CHAT training, use what's called the Foray dialogue approach to experiential learning that's described in Joy Norris's book, From Telling to Teaching. Here's how it works. An anchor connects to what the children already know and grabs their interest. An ad gives new information. An apply gets kids learning by doing. And then the away encourages them to use what they just learned. Now, how that connects to the 4-H experiential learning process is that the Foray approach sort of front-loads the experience part of the 4-H experiential learning process. So there's an anchor and an ad, and then we move to an apply, which is part of the experience, but it also is built into CHIF and CHAT, the sharing and the process of the 3 steps of the experiential learning process. That's usually in some sort of an interactive process where kids are actually getting hands-on. The away is really part of the part 4 and part 5 of generalizing and then applying what is learned, not just in the actual session itself, but also in their lives, usually in the coming week. The Foray model is a little easier to use, perhaps, than the experiential learning process, and that's one of the reasons why we built that into the chat program as well as the CHIP program. Now, here's what we're going to do today is give you a tour of the Chat Facilitator Guide, which we designed specifically to help you implement chat, and it was written based on input and feedback from local educators as they piloted the chat programs in their local arenas. So here's the table of contents, and there are two main parts. And the first part you'll see is sort of lined up across the page there. And that is the guide for educators and facilitators of the chat program. Adult mentors might qualify there as well. And then there's also a set of handouts that are directed towards the teens and to be used during the teen training. Today we're going to spend most of our time looking at the sections on recruiting and training teens particularly. Okay. So the guide includes a step-by-step overview of how to implement chat successfully based on what educators have used chat, told us what they needed to do. So the first step is planning, and for that we give you some important tips on how to effectively use teens as teachers. Okay. There we go. So you see a little extra opportunity there to see the individual steps as we go along. Now, the important section of Teens as Teachers is a set of tips that is taken from an in-depth research of 14 cross-age teaching programs in the San Francisco Bay Area. This research formed the basis for our development of chat and for the Facilitator Guide, and it can really help strengthen your local program. Let's take a closer look at some of these successful programs and what they say. So they looked at successful programs and identified that they had some similar characteristics. So first, teens tend to teach kids who are 2 to 3 years younger than themselves, so they have a little extra authority and a little more of the younger kids looking up to them. That the teens do the actual teaching. They don't just assist an adult, they're actually involved in the teaching process. Teens need to teach small groups, the kinds of groups that they can control easily, but not one-on-one. They do better with small groups of kids than on one-on-one. Teens also need to be trained to teach a particular curriculum, which is one of the reasons why the chats are trained to teach CHIP. And the programs also need to be long enough so that the teens develop a relationship with one another and also with the children that they teach. All of these are part of being a successful program. Now let's take a look at some of the 12 essential elements that they identified as well. And the first is pretty obvious, that teens are capable of teaching. The second is that an effective program director is essential, and what's useful to remember about that is that the more training that you have and the more preparation that you do in understanding how to use chat and also knowing the CHIP curriculum, the more effective you'll be at helping teens be able to teach CHIP. 3 is that the teens need to be formally selected and recruited. So that means that it elevates the level of commitment that a teen has to the program. So we've included things like applications and contracts so that the teens have this sort of formal commitment to being a chat. The type and structure of the curriculum matters, which is why we have identified that Foray process, which is easy to teach, and we've laid out the curriculum in a way that is scripted, meant to be done in their own words, but still identifies the key points and doesn't give too much information. Paying attention to details, of course, always matters, as does providing really excellent initial training to the teens. And we have given you a full outline of how that training might be. course, once you've done the initial training, you're not done. You need to provide ongoing training and support as well. And you need to offer some team building opportunities. That's one of the benefits that teens feel like they get from being involved in a program like CHAT. And so when they develop a sense of team and camaraderie with the other teens, that matters to them, and they do better. You want to prepare teens for success. Again, that training is so important, such an important investment. And the teens do well when they're offered some recognition or reward. It doesn't always have to be in a monetary fashion, but something that's useful for them, or just a sense of appreciation that they were involved in the program. Giving kids a voice in the program and involving them in some of the decisions that affect their teaching matters and helps them be successful. And then finally, to monitor and evaluate both the teens' performance as well as the program itself. All of these elements are really important, and we have built all of them into the CHAT training process. As we got started with CHAT, we started to ask the county staff what they really needed. And they said, tools that we don't have to invent. So we tried to include as many of those as we could. So what we had identified there were sort of templates of tools, and you can use these as they are or adapt them to meet your own specific needs. One of the things we heard early on was that programs didn't always provide the adequate space or time for you to take teens to teach them, the children there. And sometimes they didn't understand that it was actually a 6-week program or a 6-lesson program, and they didn't necessarily have the same children participating each time that the teens would come. So at any rate, we put together an agreement form that lays out what we think you're going to need from them and gives a clear idea of what you will do, and so they can understand that too. So consequently, this again is one of the tools that we put a partnership agreement between you and whatever program you may be teaching CHIF in. So back to the implementation section, the next step is to recruit your teens. And you want recruiting the teens, and particularly the right teens, you want that to be a really important step as your process. So these might be teens that you find through your 4-H clubs or through youth employment programs or from schools or through the service learning, the participation in government classes, consumer and family science health classes, or homeschoolers. And later in this webinar, you're going to hear from some experienced experienced educators who have found teens in a variety of places to participate in the CHAT program. To help us with recruiting, and because educators asked for flyers, we created some. So there are 2 for use with teachers that address the New York State Learning Standards in Health, PE, Consumer and Family Science, and Service Learning. There's one for teens themselves, and there's one for recruiting sites to teach in. So you have a variety there, again, to use as they are or to adapt the information from them. We also created some sample news releases, newsletter articles, and a letter to school staff, all designed to help you recruit chats and all the items that were requested, again, by educators. And we have an example chat job description, again, that you can use as it is or adapt, and that will help the teens know what they're getting into as they apply to be a chat, as well as a formal a chat contract, and there's also an application that the teens fill out in the process of being there. Again, connected back to the teens as teachers research.
Right. Moving on to training the teens. Training teens well is an important investment to the success of this kind of a project. Counties have used different models and different time frames for training chats, including one very successful model of 4-H and nutrition educators teaming up to train teens. Regardless of how it's set up, the content is basically 12 hours of training that prepare teens to teach all aspects of the Choose Health curriculum through educator demos and teen teach facts in particular. And they also, in the training, are learned to use teaching strategies while doing their teach facts. These 12 training modules are detailed in the Chat Facilitator Guide and, in fact, make up the biggest portion of the guide because we've written these in the 4As as well to help make it easy to do this training. And because training teens is so important for them to be successful. And you also need a copy of the training handouts for each of your teens in conducting your training. So with this 12 hours, some people have done 3 different days for 4 hours each day. Some have done an all day followed by a half day. Some have done an initial extensive training, but then additional training before each lesson is taught. There's a variety of ways to do these 12 modules that add up to 12 hours altogether. So here's Module 1 of the teen training, in which you and the teens play a team building game from the Lesson 1 of the Choose Health curriculum, and then teach the rest of that lesson to the group so they get a first-hand feel for what they will be teaching. As you can see here, each module has a overview or at a glance at the top, just like the Choose Health curriculum does, and it's scripted and in 4A format. Again, the anchor, add, apply, away. That helps to make sure that the training is hands-on and interactive. It has what you say to the left, and again, scripted, but we do encourage people to use their own words, but it's an easy way to get the content of the message very clear. And then on the right, in colored boxes, are what you do. So the whole training is set out in this format to make it easy to do. Following their experience of being participants in Choose Health Lesson 1, Module 2 has the teens do a brief interactive activity to get them thinking about what makes great teaching and what they want to be like in a teaching role. Then you'll come back to these tips later in a later module and go into them in more detail. Right now it's just a quick snapshot of thinking about teaching. And also in Module 2, after participating in the first lesson, the teens review the nutrition content of that lesson in an interactive way, using these flashcards and moving around the room, finding the answers in the lesson background page if they need to. The background page for each lesson, you can see the one that's shown here. There's one for each lesson, and there's a set of flashcards for each lesson to make it a more fun way to review the nutrition content. Having a good understanding of the nutrition content of each lesson is really important to help the teens be confident teachers. So that's why we develop these flashcards and interactive ways to use them to make that process more fun. And these cards are also used in our adult training as well as in the teen training. Again, we just found it was a good way to review the nutrition content. Okay, so that's Module 1 and 2. In Module 3, you'll hand out the CHIF curriculum itself and give teens a little time to leaf through it, enough just to see how the lessons are laid out, see the key elements, the 4A, games, food preparation, family newsletter, and the goal setting, and so on, which is also shown on this. This is the first teen handout that the teens get in the training. So it tells them a bit about the CHIF curriculum as well. Okay, so now Module 4. Module 4 reviews the Choose Health behavior goal by having teens do a mix and match using this table, matching statements about why each behavior is important and how to support it with the health behaviors that we're working to change. This gets them thinking about the behavior goals in an interactive way and helps them know a little bit about the why behind each lesson. Now, Module 5 revisits the great teaching and the facilitation skills and gives teens more details about them. You'll ask the teens to think about great teachers that they've had and what made those teachers so interesting, and jot down what those teachers did on sticky notes. Then the teens will put those sticky notes onto charts that correspond with the various skills on this handout. And so this is a nice introduction to goals. Anyway, the teaching tips that you'll want them to do as well. And it helps them get more familiar with those skills by thinking about what a teacher that they've had did that fits into these different skills. And then your way is to have the team circle a skill that they want to work on. And this is a nice introduction to goal setting, which you'll talk more about later in the chat training, as well as doing during each of the CHIF lessons. In Module 6, you teach the CHIF Lesson 2, just as it's written, which is on vegetables and fruits. And then you'll debrief by asking teams to use this mentor observation sheet. This mentor observation form to identify facilitation skills that they saw you using. Again, it gets them thinking about these facilitation skills. And you'll use this form again when you observe the teams teaching the rest of the CHIF lessons as teach facts in the training, and also when they teach for real. It's a good tool that helps you give teams meaningful feedback each time they teach. Which skills are they doing well? Which skills do they maybe should think about a little bit more the next time they teach? And it also becomes part of the chat evaluation. Module 7 is about helping teens understand the kids they'll be teaching. Sally, you want to tell us about that?
Sure. You're going to use this handout as a way to help them understand the pieces of youth development and how they will be giving a quick overview of that and understanding that for themselves and how they'll be working with the children. And then, of course, knowing the children and knowing the audience you're teaching is really important. So we have a puzzle process that helps kids learn a little bit about the 8 to 10-year-old and the 11 to 12-year-old, the children that they might be doing. So they're looking at some very broad kinds of characteristics of these different age groups so they can tailor their teaching to meet kids' needs. And then we also included a 2-page handout on age-by-age characteristics of kids from 7 to 13, a little bit younger and a little bit older because we know kids of different ages are different. And a 7-year-old may act like an 8-year-old and vice versa, so we needed to give a little extra information. This comes out of a great resource for youth development workers called Yardsticks. It's by an author named Tripp, and we don't expect you to go through the details of this in your training, but we sure didn't want to miss the opportunity to give kids a reference, to give teens a reference that they might use when they encounter a challenging child or situation. And some of these characteristics may help them deal with those challenging situations. For the final part of Module 7, we're going to ask you to share as much as you know about the actual audience that the teens, the chats, will be teaching the CHIF curriculum to. And this handout is a general description of kids in an after-school program setting, but if you can find out more specifics about the ages, the program schedule, what schools the children come from, what they like to do, all of that kind of information will help the teen chats anticipate who they'll be teaching and help them be able to do a better job with that. In Module 8, the teens get their first try at teaching CHIF to each other as they teach lessons 3 and 4. And then after each lesson, you'll debrief kindly using the mentor observation form and asking for the presenters and others' input on the teaching skills and that they saw and what they might do to improve and do an even better job next time. You'll also, again, review the nutrition content of each lesson in an interactive way using the flashcards provided. And I think we have a tracking and training and readiness tracking form that we can show you here too that we created so that you can use this form to make notes about, again, what level of confidence the teens have, what they might need to work on, and then how you might be able to supplement your training to meet the challenges that they may have. Module 9 helps teens learn the art of leading active games, which are an important and integral part of the CHIF curriculum. Now, there are there are tips for leadership in the CHIF introduction, and so you're going to ask the teens then to teach each other these tips for leadership become an expert in each of the tips so that they can share that information with others to help get at that artful process of teaching and leading an active game.
All right, and then
Wendy, you're up.
Module 10 has teams teach the shift lessons 5 and 6 as teachbacks. Debriefing again each time with a mentor observation form that you will fill out and discuss with each team, and using the flashcards to review the nutrition background for each lesson. So this takes the group all the way through all 6 of the Choose Health lessons, 2 that you modeled how to lead, and then the rest taught by the teams with each other. Again, there's that mentor observation form that you'll use. Then Module 11 focuses on goal setting and asks teams to plan to set a goal as they help teach each of the 6 shift lessons, and then journal their progress a bit. So that often the lessons are once each week, so they have a week to try out the goal that they set as part of the lesson. And the younger kids that they're teaching are also setting a goal at the end of each lesson. So they participate along with that, but then the teens are asked to also, at the next lesson, just jot down how that went in a sentence or 2. And this not only helps the teens be more likely to change their own behavior, because there is some research showing that goal setting does help lead to real behavior change, but it also can become a part of the evaluation so that we can capture such changes by the teens. Sally?
And then finally, Module 12 is intended to encourage teens to really prepare well and have them think through what it's like to work with a partner. It's a wrap-up of all of the previous modules, and it's a chance to delve into the logistics of where and when they'll teach shift and to get ready to deal with those logistics. This scheduling chart is also something that we included, although the ideal would be that the same teens would teach all 6 lessons. Educators have told us it doesn't always work that way. So regardless of how of who's going to do what, you're going to want to know which part they're going to play for each lesson. So during Module 12, you'll want them to get them to commit to what they'll do and when. And so those are the whole 12 training modules, and they're all laid out for you in that Foray style in the chat facilitator guide. And then the teen handouts is a separate file that goes with the lessons. And the next part of the guide is Section 7, and it's short, but it's an important reminder that the training is never done. Each time the teens go out to teach, they still need to have your support and clear, timely feedback. Included here are some tips and a few suggestions if you need to have additional debrief questions besides the chat mentor observation form.
Okay, and then the next section is program evaluation of the teens who are teaching the chip to the younger kids. You probably know, of course, the program evaluation is increasingly important. It not only helps to improve the program, but it's essential for getting funding to support and expand the program at both state and local levels. So as detailed in this section, Section 8, beginning with these instructions that talk about the different components of the evaluation, there's 3 components to the chat evaluation, and we ask that you try to include evaluation in any chat programming you do, and then send your completed forms to Cornell. You saw 2 of the evaluation forms earlier, since they're also used for other parts of the project. The goal setting and tracking form, which we just saw, where teens are asked to set a goal and then report briefly on how it went, is also used to document behavior change in the evaluation by confidentially aggregating these reports. And similarly, the mentor observation form, we ask that you send in the first and last of these forms so that we can compare teen growth in teaching and facilitation skills over the course of their experiences by confidentially comparing how they did on the first one to how they did on the last one. And we're seeing already that they're improving in skills, and this is a way to actually quantify that, get a hold of that. And then the third component, and probably the most important, is the teen questionnaire that they fill out themselves. It's a brief evaluation question to be completed by teens at the end of teaching a 6-lesson series that assesses retrospectively change in both leadership skills and eating and activity behaviors. It was developed based on literature review and expert consultation, and it takes about 10 minutes to complete. And we have some early results from 45 teen questionnaires from 9 counties in New York State that conducted chat programs from May 2010 to August 2012. And these results suggest that following their chat training and teaching experience, teens not only improve in leadership skills, but also change their own eating habits. Specifically, teens felt more capable of teaching others, had greater leadership skills, and knew better how to use those skills, and agreed more strongly that they were role models for younger youth. In terms of eating and activity, the biggest changes reported were drinking more water and less sweetened drinks, eating more vegetables and fruits, being more physically active, reading nutrition labels more often, and eating breakfast more often. So it's good to see that we're seeing both leadership skills and changes in their healthy behaviors, which is the goal of the project. I also want to briefly mention a tool called the Cornell Healthy After School Self-Assessment Tool, or CHASE, that can be used with chat or CHIF if you're working in an after-school program. This tool is available on our website, and it was developed to support the increasing evidence that the direct education, like teaching CHIF to youth, is not enough. We also need to create environments that support healthy eating and active play, like offering vegetables as part of snacks and offering water and milk rather than sweetened beverages. This is what the tool looks like. It has an overview and an introductory letter that you can use when you share it with after-school directors, and then a page of questions for each of the Choose Health behavior goals. For example, the first question here on the sweetened drinks page is how available is drinking water to children? And then for each question, the ideal supportive environment is shown on the left-hand column and less supportive environments in the remaining columns. So wherever they are, if they just move one column to the left, they've made a small change that might make a big difference. So the idea of this tool is for the after-school program to assess themselves and see how they're doing in being supportive of healthy choices and think about ways they might change. And you could have a discussion with them and help to suggest possible ways for them to be a bit more supportive without costing a lot of money or anything. Okay, Ellie?
So we promised earlier that we would let you hear from some local Cornell Cooperative Extension educators about their experiences with the Choose Health Action teens. And here they are, the three lovely women that offered to share their experiences with us. We'll ask each of them to introduce themselves and tell us a little bit about how chat worked in their area. Debbie, you're up first.
Great. Hello. My name is Debbie Seguin, and I am an issue leader working in both 4-H and nutrition programs here in Madison County. And we've been able to work with both chat and CHIF for the last 3 years. So we've had a lot of interesting experience with it. And I'm just going to talk a little bit about the benefits of using the chat model, because I know that people are using CHIF and doing nutrition programming in a lot of different ways. But I really like using the chat model because I think the younger teens or the younger kids really respond well to teenagers, looking up to them as role models. And I just think it's a model that works well. We did find, however, that there really needs to be a fair age difference. I think you mentioned earlier maybe 3 years or so, because one attempt we had younger teens, and for us that didn't really work out so well. There might have been only 1 or 2 years difference between the teens and the younger kids they were trying to teach, and that was a little more challenging. But I think in general that the younger kids respond well to teens. I think it's also a great way to involve teens in working in their community in a meaningful way, giving them some real responsibility and real skills, and helps them to build their confidence and their resumes, which is really important for them as they're entering the work world. Also, we've had a great experience with the visibility for CCE work in this area of healthy eating and child obesity prevention. People like to hear teens, doing good things in their community and like to see when they're making an impact. So we've had teens sharing not only at the local level, but we've been able to have opportunities for our teams to go both to Albany and Washington to talk with folks about this project. So talk about a great leadership experience. And also, I think you mentioned it, but the teens become more knowledgeable about nutrition and work on changing their own habits. We had one example of a young man who was one of our teen leaders, and he was drinking quite a bit of soda every day. And after we did that lesson, he said, "Boy, I never knew that." And he actually cut out the soda completely and lost like 10 pounds. He was just so surprised at that. Maybe most of us wouldn't be, but it was great for him to have that experience. Okay, and I guess I'm talking a little bit about recruiting teens also, because now that I've talked about how great it is, one of the challenges though is finding the right young people, and of course that makes any program's success is having the right people working in it. And we have tried a number of different things, and what I can say is there's no magic formula. We have started just trying to find ways where we had connections with young people. We have used some of our older 4-H members who were involved in our club program. We also were very fortunate to work with a summer employment program, and we had teens who were actually paid by another entity, and then they worked with us, so that was a great situation. We've also had some college interns. We're now looking at perhaps working with a local reality check kind of program where they already have some teens working, and they might be interested in branching out to some other healthy lifestyle activities. So that's one we're looking at. One of the things we have found is that offering stipends or some kind of award, whatever you call it, really helps to, because we're competing with jobs and other commitments for teens, so that helps them to be able to say yes and put in the time that you really need to put into to be successful in this project. Okay. And also, I labeled this 12 hours really because that does sound like a lot. But I can't say enough how important that is to have the teens have enough opportunity to build their comfort level and their confidence. The training that we did, we've done it a couple of different ways, but the most recent one last summer, we actually did 2 days of training, and they were about 6-hour days, give or take a little bit. And we did that in the early summer, and that was a way to get the teens together and really concentrate on learning with this project. The training's so important because they actually get to experience the games and the recipes and the activities, and sometimes it's just hard to see how these things work until you actually do them. So that was really important, and we could even see a difference from the beginning of the training and the end of the training and the kids' confidence, comfort level. It was really good. So you could see how important the training was, and having practiced with that 4A approach, it's not a hard approach to learn, but you really do need to practice it to feel comfortable and to get good at using it. And then, of course, the value of modeling. It was important for them to see some of us teaching, but we also had an opportunity to have some teens come back and work a second year with us, and we were able to have some of those teens actually involved in the training, so other teens could say, wow, if she can do it, I can do it too. So learning from each other, giving feedback was really important during that training. And then the last piece is emphasizing those key nutrition messages. We used the Jeopardy game, flashcards, and that was a great way to reinforce the core nutrition messages behind the lessons. And they sound simple, but it's really important to get the information straight so that they're sharing the correct information when they're talking with young people. So I think that's about what I have to share. Thank you.
Thank you, Debbie. Linda.
And Linda's up next.
Hi there, I'm Linda Tripp. I'm the issue leader for the 4-H Youth Development Program in Columbia and Greene counties. And I've had the pleasure of working with this program since its inception in New York State. I don't know how many years ago, probably 4, 5, 6, 7 or so years. And I think one of the biggest successes I had when it came to recruiting teens was recruiting kids that were in my 4-H club program, in the county program already. And the first crew that I had were about 7 teens, and some of them were young, were like 7th or 8th graders. And that worked out really well for me because they've been able to stick with the program, most of them, for the whole time until they graduated. And if you want to see in the slide, there's 4 of those teens right there, and they all started. And Jared, the young man up in the right photo, is the only one who is really not a senior yet or graduated. But that really worked nice because we could do the training, and then they were able to come back for several sessions of working as a teen in the program. For me, I found that with them it was easiest to train in the evenings, and so we did several evenings in a row of trainings with them, and they have really helped out a lot in that they've taught programs at summer recreation sites. Usually those were once a week for 6 weeks in a row. At libraries, we've been able to hold the program, and in after-school programs. Luckily, I had a couple of teens who were homeschooled, so they were able to come and do some classroom work as well with the Choose Health program. So those are some things that really worked well for me in that manner, and the places that we were able to present the program. Some of the successes that I had with the teens, which is the benefits for them in particular, is that they really have. It's really affected how they look at their lives and where they're going with that. The young man there on the right, Jared, he is now a junior in high school, and he is thinking of being a chef or at least go into that profession. Lizzie, who's in the middle photo, she's a senior this year, and she did a lot of work with me with special needs kids, and she just loves that, and that is definitely the route she is going into as she's graduating and going on to college. Rachel is on the left, and she is a senior this year in high school as well, and her aspirations are really to look at community health, and in particular now she wants to do research at the Centers for Disease Control. So all 3 of them, as well as Jared's sister Emily, who's in college right now, she is on her road to becoming a dietitian and actually coming back this summer to intern with me and probably go out and teach some Choose Health programs for us this summer. So definitely these kids, when you let them go, and especially if you can have them present the program more than once, they build their confidence, their skills. They're able to work together and learn how to do that. Besides the fact, as was previously mentioned by Debbie, is they really, it does affect how they eat and view physical activity for themselves. So it's really been a worthwhile program all the way around. The teens learn as much or more as the children who are actually recipients of the lessons. I'm thinking that pretty much covers everything I was going to share with you.
Great. Thank you, Linda. And Vikki.
Hi, everyone. My name is Vikki Giratano. I am the Nutrition Program Manager and the Director of Family, Youth, and Community Development in Broome County, upstate New York. Our experience with the training has been amazing. We have been so excited, and what you're looking at are some pictures of our teens leaders, our Citizen U teen leaders who are in the lab coats, doing the education series and stations with all of the youth at one of the housing authorities, and it was just an awesome experience for them. We decided to use current groups that we had of young people who were already charged with making change in their community. And this group was very interesting because they had already wanted to make change. One of their projects was to develop a coloring book called Choose Health, and it had nothing to do with the curriculum itself. They knew nothing about the curriculum, but they wanted to go in and work with second graders at a school, and they wanted to get them to eat healthier because that's what they felt was very important. And that came a lot from directive from Michelle Obama and the obesity prevention work that was done. So these teens were a shoo-in to be able to make this work. But then also replicating the training in Rochester, Monroe County, and with our Teen Leadership Action Council, it seems like they're really excited. Young people today are really excited about being healthy and being able to teach other youth. And like it was just said in the previous presentation, it gives them the opportunity to teach, and they start to develop some skills that either transfer into workforce skills in the future or college and career goals for them, which is just an awesome thing to see. Most recently, our teen leaders wrote skits and plays, and they went to a low-income elementary school. And we partnered with United Healthcare. They're one of our partners, and very excitingly, we're able to partner with them for some. Dr. Healthy Hound was with us, a big, large dog, and I think maybe somewhere in some of the slides there might be a picture of him, but if not, he just drives home the message of being healthy. So we had stations of young people experiencing all of the lessons that were in the Eat for Health curriculum, and then the school has asked us to come back. So we've been there twice so far. We plan on going over and over again. The ahas that surprised me when I was training the young people were just amazing. First of all, the leaders in the group, they all decided they weren't drinking soda anymore or eating fast food. So the adults that were with us made changes too. They're like, "Oh no, I won't eat that anymore, or I don't drink that anymore." That was the funniest part, because here I was training the young people and the adults were all like hearing the message. The teens that we taught loved the idea of that they got to teach the group and that it was modeled for them. They felt like they could be successful based on the curriculum, and that was the one really exciting component. And, some of them realized I don't want to talk in public, and that was okay too. The nice thing about having a group is you can find a role for everyone. We need things set up, we need things taught, we need things copied, so they could all be a part of teaching the curriculum to the younger youth. Let's see. My experience teaching youth that didn't want to teach back was that the leader was inside of them, and if you let them go to the outside of the group and not force them to participate, eventually they wanted to participate, and that was really neat to see, especially with our youth that are in very low-income neighborhoods or they've never had the opportunities or experiences. The other thing I loved is being able to connect this curriculum and this training to Cornell University and the Division of Nutritional Sciences. They thought that was really cool, that they were like doing something that was connected to something a little bigger than them, and that this curriculum was written there, and they thought that was really neat as well. We have a new site. It's the Boys and Girls Club in Binghamton. They have over 150 youth there, and we are doing groups of we did one group of 24, and we realized we cannot train 24 youth. Our teens couldn't handle it. Our educators couldn't handle it. So now we're doing groups of 10. But these kids are so excited about what's happening. And by the time they get to lesson 6, because honestly 5 isn't enough for them, they wanted more. By the time they get to lesson 6, they're like, we can't believe it. It's over. We can't come back. And because in the beginning, they're just these young kids, they're like, I don't want to do this program. I want to go play basketball. But at the end, they're telling all their friends, you get to do that. And the kids are coming back in and telling the educators, hey, I'm reading labels, or I'm not eating sugary snacks, or I changed my drink. And so hearing little ones come back and tell the educators that, whether they're the teens or just our nutrition educators, they're getting really excited about that because they're seeing that they made a difference, and that's so important to them. It's not a survey. It's a kid coming back in the door, and that's just amazing. We have lots of new requests in our community. People are asking us to come. Word of mouth is spreading, and I said, we're going to have to get a whole new group of teens trained, because the one challenge is draining the teens, right? They're not always available when we need them, and so it's important that we train lots of different young people and different groups of young people, so that way when one's not available, we're still able to go out and do the great work, because I have to tell you, the most important part is the fact that the youth, these second, third, fourth, fifth, and sixth graders, they're receiving it so much differently than if it was just an adult coming in to teach. So the fact that the teen leaders are coming in to teach, wow, that's really cool to them, and they're hearing it differently. So it's very exciting work. We're so proud to be a part of this initiative in Broome County, and we're so excited to see where it goes in the future. And that's about all I have to share right now.
Thank you, Vikki.
You're welcome.
Wendy, you want to wrap up?
Yes, thank you, Vikki. Thank you, Linda. Thank you, Debbie. It's great to hear the local experience. So to wrap up, let's talk about where you find the chat and the CHIF materials. They are now available on our website, fnet.cornell.edu, under our initiatives. You may already have found this website to view this webinar. But if not, that's where all these materials are. It's the Cornell Food and Nutrition Education in Communities website. There you'll find the chat facilitator guide that we've just walked you through, as well as the chat handouts for teens. You've seen some of those. The nutrition flashcards that we've shown you. The recruitment flyers are there so that you can easily print those. And the whole Choose Health, Food, Fun, and Fitness curriculum, along with each of the lessons, along with ready-to-print visuals, handouts, posters. There's even scanned food packages there so that you can print out sets of food packages to use with label reading and the different lessons rather than having to try to gather your own. We also have a CHIF training guide so that local trainings can be conducted to teach teach adults and chat leaders and others who want to learn how to learn the Choose Health curriculum, the training that can be done locally. There's also on there instructions for putting together grab-and-go kits of these ready-to-print visuals and other materials that you need to teach this. And you can add to that some measuring cups and soda bottles and a few things like that, and you've got these ready-to-go kits to go out in the field and teach with. And finally, there'll be regular chat updates from the field. You've heard a few right here in this webinar. We have quarterly conference calls where educators share what they're doing with chat, and we've got some of those from the past, and we'll continue to add new ones as they come. And anyone is welcome to join those calls. You can just let me know of your interest. So let's end with an away, as we call it in the Foray lingo. What will you do next to put chat into action in your county or state? Again, all of the materials that you need for chat and CHIF are available to download for free. Be sure to view the CHIF webinar and get orientation to the CHIF curriculum and its visuals and training materials and so on, since that's used as part of chat. And if at all possible, try to connect with an experienced chat or CHIF facilitator or others with relevant experience to get training or support to conduct these programs. Think about your skills and where you might need support. These programs were developed as a collaboration between 4-H and nutrition programs, and each brings strengths to the collaboration. So if you're strong in youth development but weak in nutrition, you might partner with a nutrition educator to help you get up to speed in the nutrition content. Or if you're a nutrition educator and you don't have strong expertise in how to work with kids, then you might partner with a 4-H educator who can help you with that aspect of this project. Finally, we just wish you luck in conducting these programs in your community. We ask you to keep in touch. If you can share evaluation results, the more numbers we have, since these are of the teens, and we often just have a few teens teaching in each program, it takes a while to gather up the kind of numbers we need to really show change. So we would love for you to share your evaluation results, and we can aggregate them into larger numbers. We'd also love to hear about your successes and try to answer any questions that you have. And here's my email on the slide here. So thanks for viewing this webinar.